Abnormal vaginal bleeding occurs in younger women mostly due to ovulation dysfunction. In order to have a normal period or normal cycle, you need to have ovulation. Ovulation occurs once a month, and if it doesn't happen, the period and the cycle are abnormal. So the most common reason in young people under the age of 30 is ovulation dysfunction. It is also important under the age of 30 in case of abnormal bleeding to exclude ectopic pregnancy by simply doing a pregnancy test. Over the age of 30, endometrial polyps and fibroids inside the uterus may be the culprit. After the age of 40, it's important to exclude uterine cancer, polyps, and fibroids. In women with abnormal bleeding, it is very important to perform a transvaginal scan, which often will give us the diagnosis of endometrial polyps and fibroids on the scan. It is also important to do a pregnancy test to exclude an ectopic pregnancy. Occasionally, we find difficulty in locating or diagnosing a polyp or fibroid within the cavity, and in these cases, we recommend the use of saline in conjunction with ultrasound, or may advise hysteroscopy, i.e. using a camera to explore the uterine cavity under anesthesia. Abnormal bleeding, which is only related to intimate relationship, is simply because of touching the cervix, some abnormality on the cervix. And the most important reason to exclude in younger people is chlamydia infection. The second abnormality is cervical cell abnormalities, which are detected by abnormal smear. So the two most important investigation, in addition to examination, is chlamydia test and a smear test.